week 2. I want you to know by the time you open your eyes and turn your head and blink, it's going to be week 10. It's going to go pretty quick. So again, I'll ask you, do not get behind. Try to keep up with the pace of these courses that you're in. Most of you are in 3, and I know it is hard. And I know this is the hardest semester that you're going to go through, except of course, capstone. Capstone's always difficult, but that's okay. We're going to get you where you need to be. Again, something happens, communicate with me. Let me know what's going on. I do have different things. I am lead. I can put you in a different class. I can do so many things to help. So we'll work together, right? If anybody is falling behind and doesn't understand something, please send me a message and I'll meet on your time schedule to help you. And I know probably it's going to end up like week 5. Cardiac is a hard subject and it's actually my forte. It is my strength. I did work in Miami Children's Cardiac Intensive Care Unit, and I opened it up and worked there for 10 years. I was a night shift person, and I was that person that everybody would go to if there was issues. So I just see a heart in my head and I just get it. It's just the craziest thing. You're all going to find what you like the best. I'm going to tell you cardiac, number 1 for me. The second one is ER, because I like to think, oh, you have these symptoms. What could you be? And then go from there. I just made it a game every day that I was there. All right, let's go ahead doing 2 things today. We're going to do a PowerPoint, 60 slides, and then we're going to do a Kahoots, and it's 55 slides. Again, anything that you don't understand, please stop me, please. Make sure you sign your attendance attestation this week. You saw some of you, I did send you messages. It's not to say that you're bad, it's just to remind you. I want nobody dropped because you didn't sign it. The second is a discussion question. I hopefully by Wednesday will have all of your discussion questions graded and look at them. This week, I'm giving you some information on how to look at questions and how to think. I'm explaining AdPi very easy to you. And also, if you don't get a perfect 20 on any of these discussion questions, look, I will put, you didn't do this, you didn't do that, try this, try that. I'm here to try to help you. I don't want perfect APA, I want your best attempt. You are an associate degree program. One of the first times you're really looking at APA and trying to make it work. And I know it's difficult. I went back to school at age 53 and said, APA, what is that? Why do I need an American psychiatric something or other to do writing a paper? I mean, that's where my mind went. So don't worry, I do get it. I understand it's difficult, but I will help you. So let's go ahead. Let's start our PowerPoint, go from there. Infants, toddlers, preschoolers. I mean, when you talk about infants, from 0 at birth to 12 months is probably, and it is, the most a child grows in their whole life. They go from 7 pounds, let's say at birth, to 21 pounds at 1 year. So not only are they growing longer, they have tripled their weight. They go from not being able to lift their heads to most children are at least walking or at least, creeping alongside of a couch or a coffee table. It's amazing how quickly they go, right? Cephalocaudal starts with the head and then goes to the feet. That's what it's called. And it's all about sequential trends. What happens in what sequence? So if you don't have proper nutrition when you're an infant, you can see a lot of problems will occur. That central nervous system is expanding. We go from not lifting heads to be able to run. So all that central nervous system and muscle development, all of this stuff is in the first year. So initially, a baby is born and they will lose about 10% of their body weight because it's mostly you've been floating in water, and that water is, you urinate a couple times and you go from pudgy eyes at birth, and all of a sudden, like a couple hours later, you're going to see that pudginess gone, that, swelling because they have urinated. Children, even infants, of course, part of children, they'll gain weight and then they'll get length. So you'll see them looking pudgier. then all of a sudden they're going to grow. And that's just that step stair type thing that children do at all ages. Infants are born, we've talked about it, heart rate 140 to 160 at birth. By the time they're adults, it's 60 to 90. So you can see how the heart becomes more efficient and effective and only requiring less beats in order to do the same thing. Same thing with respiratory system. So I sent you that chart. Look at it, understand it. You're going to need that understanding of vital signs to answer questions. If I gave digoxin to an infant and the heart rate was 100, is that good? Do I give it? So there you go, why you need to know it. So no, you wouldn't give it. You would absolutely tell the physician, probably do a digoxin level. Another thing about infants, they are born with mommy's immune system and mommy's blood. After about 3 months, these cells start dying. So you go into a physiologic, what we call anemia, because the body doesn't make cells yet until 3 months, up to 6 months is when they start. So born with a normal hemoglobin hematocrit, by 6 months, it could be 9 and 27. And that's absolutely normal because now the body's going to start making more. It also has to do with your immune system. You will see infants initially really shouldn't get sick because we have mom's immune system. But after 3 months, you're going to start seeing children, infants getting sick because now the immune system of mommy's going away. Why do you think we start all of these immunizations and a lot of them 2, 4, 6 months? We want to cover that infant for those bad illnesses so they don't get extremely ill. At least they have some protection. Their heads at birth, we know, are big and their chests are small. By about 1.5 years, we know that the head should be equal to the chest or the chest should be bigger than the head. And if it's not, why? So to go look at that, maybe it's extra fluid in the brain, maybe it's a tumor, who knows, but it's something will be investigated. 2 soft spots are there, posterior and anterior fontanelles, and they close 6 weeks and then about 1 to 1.5 years. Now we check those and look at those. What if it closes too early? Well, the brain still needs to grow. It gets squished, right? So it's important to know it. What if it doesn't close and it's still open? That anterior fontanelle is still big and open. Well, why is that? Again, is there hydrocephalus? Is there a tumor? Is there something that's going on? So these are things, some of those developmental checks that we look at. Their hearing becomes better. And we know that their vision at first, the first 6 months up to about a year, they see out of one eye and the other eye, but they don't work together. It's, this eye works, but then try to grasp something, but because they don't work together, depth perception is all off. But as they get older, it gets better and it gets more improved. As I said, central nervous system is growing really quick. I mean, you can't lift the head when you're born, and by 1 year, you're at least walking around. The central nervous system has to work really quick. So keep giving that nutrition to the nervous system, which helps with muscles and get them up and moving, is so very, very important. Again, their immune system, we know at birth, I've got mommy stuff, and mommy stuff really helps me. If an infant is fed breast milk, we know mom is giving all of those good antibodies to that infant to protect them against diseases. I know my daughter, she's a reader. She reads everything. And she breastfed her infant. And she actually, because of her reading, taught me so much. She said, well, Mom, if I get sick and I'm close to that infant, my body's already producing antibodies. So if I'm giving her the baby breast milk, guess what? He's getting protected because of that. My body is working to protect. And that's why breast milk works. At birth, sometimes you see these babies with this vernix caseosa, and it's that white cheese all over. I mean, I found a really good picture that shows it. Sometimes there's a little, sometimes there's a lot, but again, it's protection. It's part of their immune system. We know their GI tract's there, and we know that As a baby is born, they are starting to make their own immune system. At birth, babies cannot regulate their temperature. Has to do with the adipose tissue, and they cannot hold their heat, and of course, their central nervous system is very immature. So at birth, we tend to put them immediately on a heated warmer, and if they're not on that, we have them covered very, very well. As they get older, they need less clothes, they need less blankets, and they need an environment that's not so hot anymore because they can take care of themselves. At birth, we know the baby's born with a lot of water because they've been floating in water. So once that fluid goes away, etc., they don't have much to take care of themselves with thermoregulation. Now the kidneys, we know adults, we look at minimum urinary output per hour is 30 mLs per hour. That's what we're told, adults. If it's less than that, it's not adequate. Well, just like giving medications, micrograms, milligrams per kilogram, the kidneys produce 0.5 mLs per kilogram per hour. And if it's less than that, then that's not enough urinary output. Now, how do we measure urine on an infant? They urinate into a diaper. So how do you measure that? Well, a diaper size 1 weighs 30 grams. So if you have a dirty diaper on an infant, you take it off, and it's a size 1 diaper, and that diaper weighs 60 grams, we know that it should be 30 dry. So the difference is 30 grams. It is 30 mLs of urine. 1 gram is 1 ml. So we can really accurately measure urinary output on infants. At birth, the GI, along with a lot of systems, are very immature. The reason why we don't feed infants right away is their body doesn't accept it, doesn't tolerate it, doesn't digest it. So there's no reason to eat it. You will actually see food, if we give that food to an infant too early, it'll come right out in the stool. So they're not getting that benefit. Sometimes we do give cereals to thicken formula or breast milk on infants with reflux, but you're going to see that cereal in the stool, but we have it there to keep the milk down so that the infant's going to get the proper amount of nutrition. Now there's 2 types of development. There's fine motor, F fingers. There's gross motor, get up and go, go, go. That's movement. Okay, head lifting, turning over, running, walking. Fine motor is all about what they do with their hands, okay? So when you read a question, be careful. Don't look at the answers and think you know it right away. Go back and look. Is this fine motor? Is this gross motor? There is a difference. So we know that there's first in a reflex palmar grasp, then there's voluntary. I'm going to grab that rattle because I want it. And then it's going to be pincer grasp, which is taking a little piece of Cheerio from the high chair, put it in their mouth. It starts out with a crude. They sort of take their whole hand and sort of smush it, but it's getting to that point of fine pincer grasp. Then we remove objects from a container, and then we build a block of 2. This is what the book says, according to the first year of fine motor development. Some children go through it quicker. Some children go through it slower, and that's absolutely normal. So there we are. We've given you a test. You can go back and look at it. Gross motor, get up and go, go, go. Has to do with movement now, right? First thing, what does an infant do? They lift their head, right? That's why if they're having some issues with a flat head from laying on their back to prevent SIDS death, we know that we can put them on their tummies. They can do tummy time, and we can take that head and get it shaped so it's not so flat in the back. What's great about infants' heads, they're soft, they're malleable, and they do remold very, very quickly. Rolling over. So why do we need rolling over? Well, about 5 months, well, some are earlier, but it's front to back and then it's back to front. If you're 5 months old, let's say even 4 months old, and you put your child on a changing table and walk away and they're not buckled in or anything, they can roll right off and right on the floor. And I can't tell you how many parents come running into the ER. Oh my God, my baby rolled off the changing table and on the floor, and it's a tile floor, and oh my God, check my baby. Well, it could be on the couch too. So teaching as nurses, do not allow your baby to be on the floor, on the couch or something unattended or not restrained, because let me tell you, infants are really quick. And then sitting unassisted, that means no pillows or anything around them at 8 months. And then they should be able go from their back and then manipulate to get up to sitting about 10 months old. So nutrition, I've mentioned it how many times? Well, we'll keep mentioning it. Nutrition, nutrition, nutrition. The first 6 months is only breast milk or iron fortified formula. If they're breastfed, they will need some vitamin D. This helps with muscle development. So we do give that supplementation. I've already talked about, losing the weight, et cetera, and urine output. But let's say you have an infant who was in the ICU and goes home and they were able to weigh diapers or see how much formula or how much breast milk this infant got, and now they're just nursing. Well, how do they know they've gotten enough formula? Well, number one, you'd have 6 to 8 wet diapers. If they're getting enough, it's going to be 6 to 8 wet diapers. And we know breastfed infants have more stools than a formula-fed baby. It's just what they are. So we know that they're getting wet, they must be drinking. The other thing is you measure nutrition by how much weight and height that they're growing, right? Isn't that measure? I get enough nutrition, I'm going to get heavier. I'm also going to grow because of nutrition. Now, the second 6 months of infancy, we're going to start to introduce food so that they're eating less milk, they're getting more food. And actually, if they're breastfed, it actually gives, mom a little bit of break of how much nursing they do. Now, what do you start first? I'll tell you, it's whatever your pediatrician tells you. There are some pediatrician who starts with the rice cereals or oat cereal, and there's some that goes right to fruit, some goes to vegetables. Doesn't matter. What matters is you introduce one at a time, and you don't introduce them 4 to 7 days for each one, and then you can introduce a new one. That's the only thing, is to make sure we do that. Another thing is at 12 months is when we introduce whole milk. They do not need formula anymore. If you're breastfeeding and the baby's still interested and they're breastfeeding well, of course you're going to continue giving them the breast, but you can put them on whole milk, not skim milk, the 2% milk. They need the fat. Infants get teeth, and there are some infants that at 4 months are getting a tooth, and then there's my kids that didn't get any teeth till 15 months, and then they got 6. So it doesn't matter. Can you imagine how much pain these poor kids were in? My poor little Christian he hurt. So of course he got a little Tylenol because Nana knew better. But usually it's the number of months minus 6 equals how many teeth they should have according to the book. Once they get teeth, they must be brushed. Sometimes just a warm, wet washcloth is fine. No toothpaste, okay? They don't need it. They can get fluoride about 6 months. The one thing about getting cavities is that nighttime feeding. They don't recommend bottles in the crib. They don't recommend any bottle propping. And that's hard if you have multiple deliveries. If you have twins or triplets, I mean, you've got 3 babies. You've got to do something to get them fed. They're all crying. But remember, those teeth are going to take a hit and they can get dental caries. And they also talk about no fruit juice, because what is it? It's sugar. So we'd rather them get formula or breast milk or food versus fruit juices at this time. Pacifier use has gone back and forth through, all the years that I've been in pediatrics. Use it, don't use it, use it. Well, now they're into it should be used. And I'll tell you many reasons why. Well, the infant and young children, what they do is to search the world as they search it through their mouth. Everything goes into their mouth. Ever notice that? Whether it's a toy, a doll, or this, or it doesn't matter, a blanket, everything goes in their mouth, their fingers, and it's part of their exploration of the environment. Now, also, they say pacifier use helps with SIDS death, that the pacifier helps that infant keep the airway open, and it will help with SIDS death too. It's part of, what they're saying now. Infants sleep a lot. Remember, they should sleep on their back. We have gone through a whole thing about SIDS death and how to sleep. At one time, they say they couldn't sleep on their bellies, but they could sleep on their sides and their back. But now, no. And then why not the sides? They felt that on their sides, they were re-inhaling their CO2, and that could be dangerous. So that's why it's now only on the back. Breastfed infants are at less chance of SIDS death than those infants that are not breastfed. And the information in your book says no walkers, swings, playpens. They're not necessary, but I think we've all used them. I think sometimes if the baby's not sleeping, you put them in a swing, and that moving back and forth helps. I mean, especially if you have a child who's colicky. We give a lot of vaccinations. Number one vaccination we give, usually before they leave the hospital, is hepatitis B. Excuse me. Now, we give them at 2, 4, 6 months. We give them at 12 months, 15 months, and then throughout, their childhood, they're going to be getting vaccinations. It doesn't matter if you are an adult or a child and giving immunizations to an immunocompromised child. We have infants born immunocompromised. What if they have sickle cell? What if they have cystic fibrosis, thyroid disease? So many things, or they're born, with severe respiratory problems. Or how about that child just on steroids, due to many different things? So we do not give live vaccines to an immunocompromised child or an adult, okay? One of the things I quickly mentioned is colic. I think probably this is the hardest thing on any newborn parent. Number one, you're exhausted. You're not sleeping. Your infant's not sleeping. You're getting no rest. All of the household is completely exhausted because this poor baby, all they do is cry. You've used the walker, you've used the swing, you put them in the car, you take them right around the block. You do so many things because they hurt and they're crying. So colic, we can, teach them about those simethicone drops. We can talk them about burping well, not overfeeding, or even foods. It could be formulas, all different things that, can cause it. I mean, if you are a nurse and you get a phone call from a mother about baby is 6 weeks old and is crying all the time and I don't know what to do, well, you don't give them information over the phone because 6-week-old infants are so fragile. They don't really have a big immune system. They got moms, but remember, it's starting to go away. Cells die, blood cells die, etc. Have that child come in to be examined by the physician to make sure what's going on. Failure to thrive. How do we know that there's failure? Well, they're not gaining weight. Okay, and if they're not gaining weight, what's going on? They're not gaining weight. They're not getting nutrition. They're not getting nutrition. They're going to be cognitively delayed. Their growth's going to be delayed. So failure to thrive would require a workup from for the physician on this infant, to find out why. Is it a metabolic problem? Is it the formula? Is it the breast milk? Is it the what that's causing it? Because we need to make sure these infants get nutrition, they get it so that they can grow properly. And if they're not, we need to find out why. A couple other things that happens is this diaper dermatitis. If we have an infant who is now 6 months old and we're starting foods one at a time, sometimes, how do you know that they're not tolerating it? It could be rashes and diaper rashes when they never had one before. So diaper dermatitis, many times it's yeast, just requires some nystatin, periods, put it in the sunlight, for 10 minutes in the morning or later afternoon, help dry it up. Or it could be the type of diapers you're using that can cause it. Could be the foods they're eating, could be a change in soaps, et cetera, et cetera. So dermatitis is, or diaper rash is a common occurrence in children. It's not just treating it, it's finding out why did it happen so it don't happen again. We're talking about back to sleep and flat heads in the back. Well, we know during awake time, we could put them on their tummy and they can help remold their heads. Or we could put one of those little helmets on if it's really, really bad in order to help reshape them. So there's different things that we can do for these children. Many times you'll have an infant, and we know putting little bows in the hair and little headbands. I mean, I used to love to do that for my children in the hospital. I would always be the one that had ribbon and bows. And if they have this, cradle cap, it's very distressful for parents. So how do we treat it? Well, wash the hair, soap and water, just like you normally would. And you could take either mineral oil, make it softer and just comb it, softly comb it with a brush or a comb, and slowly we'll get that cradle cap to go away. SIDS death, I didn't understand all the risk factors until I started teaching pediatrics full time. And SIDS death, one of the ones I didn't realize was that males have more chance of SIDS death than females. And there are some ethnicities that, can cause it also. Children who are breastfed have less chance. Children who've just had a cold, co-sleeping, overheating, things in the cribs, soft stuff in the cribs. These children are more at risk for it. Another condition is what we call ALT. You might have an infant who just gags and chokes and turns blue. Sometimes happen, could be crying, could be reflux. Well, these children, we are here and making sure that we find out why. Elvira, did you need something?
Yes, please. Why would lack of breastfeeding be a cause of that? Is it like immature
It
lungs?
has to do with the immune antibodies that the mother gives that infant. Therefore, there are less chance to get sick, have upper respiratory colds that could cause it. That's why the breastfeeding gives that immune system to that infant. That's why.
Okay, thank you.
No, you're welcome. So ALTs are that child turning blue. They're admitted. We look for reflux. We'll do tests. We'll even do tests neurologically. Was there a seizure or something going on? And after we do our evaluation, these children are sent home with an apnea monitor. And this is something, it's just a piece of cloth that goes around, the nipple line, has two probes on it. It's soft, it's not bothersome. And these children are put to bed, sleep with it on. So in case their heart rate drops, this horrible, horrible, loud, ear-piercing alarm will sound off. Number one, it's going to wake up the infant, and it's going to wake up you to go check that child, because you can't be there 24 hours a day watching your child. You need sleep too. So this is something that can help. So question. Letitia is a breastfed infant being seen in the clinic for her 6-month checkup. Her mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention? Why? Why do you think she's doing this? They explore their world through their mouth, right? Don't they relieve stress, self-soothing through their mouth? So for them to suck a finger, a thumb, a pacifier, absolutely normal at 6 months old. That infant is trying to self-soothe themselves. So let's look at some theorists. Let's go to Erickson. Probably in Erickson, the two ones that we see the most questions on are about infants and school-age children. And infants, Erickson talks about baby cries, somebody goes, picks them up and meets their needs. So that baby is so happy because I cried, somebody came, not immediately, but reasonably came, and I was fed. My diaper was changed. I was burped. I was held. I was whatever I needed. Their needs are being met. Now, what if you have a situation where maybe there's too many children, or maybe it's a family and drug use or abuse going on in the family? Nobody goes to pick up that infant. Well, the infant has no trust that nobody's going to get them. It's going to be an unhappy child. And actually, that infant, after a while, is going to even stop crying because nobody's coming, even if I cry. So you can actually tell when an infant is in a mistrust situation. I mean, infants' needs should be met. They cry, somebody should go take care of them, whatever it is. And if they're not, of course, we know that's mistrust. Now, Piaget talks about a couple different things. So Piaget, initially, it's sensor and motor. And we talked about this a little bit last week. It's all about touching, seeing what things are in the mouth, exploring the world through their mouth, and then taking things and moving them around like a rattle in their hand and listening to it, make noise as they move it. Pre-operational is all about understanding what you see. It has to be concrete. I have to see it. Showing you how to rattle it could have been what you needed to do. Or maybe it was a toy that you needed to just touch and a light went on or a noise was made. It's concrete. They have to see it. They have no logic. They can't put two and two together. They only know what they can see. But when they get to that concrete operational, they start putting things together. Well, if the truck moves because it has wheels, so can this and this and this. They all have wheels. Now that's logical. That's making sure they all can do it. So those are the two things about Piaget. Give you some examples. In the sensor and motor, there's two different types that goes into it, but it all happens with, finding that they have a thumb and they suck it. It makes me feel good. So they first found it by accident. It just sort of slipped in there one day for whatever reason. Well, now when they're upset or need comfort, they put it in because they know it's there. So they remember it. It's like the gazing, the reaching, the grasping. They know, oh, let me get that rattle. Okay, it's a process of learning and then them doing things with it. Body image and other things here. Let's talk about this. Object permanence. Our toys, children see it. And then all of a sudden they don't see it, but it's down on the play area or it's in the crib somewhere behind something. Even though they can't see it, they still know it's there. As they get older, you take a child's toy or doll away and put it in the toy box. Even though they don't see it, they're going to go to the toy box, open it up, it's still going to be there. Object permanence. They also start to understand and look at their body. They're looking at their hands, right? Sucking their hands, feet come up in the air and the feet go in the mouth. This is all about learning their bodies. And then, of course, if you have a mirror there, they're going to look at it and try to touch it. And actually, they try to talk to it and they coo to it. Socially, we know that young infants only want to be with people they know. That's where they feel the most comfort. When a stranger tries to pick them up, they're going to turn around, hold on tight, and not look. Go away, be gone. But as they get older, they're going to look to see, are they still there? It sort of becomes more of a game. And if you have an infant that, let's say, all of a sudden, you have to put a kid in daycare, and you have to go back to work, and the kid's 3 months, 4 months, you bring the kid to the daycare, you hand them to the daycare worker, and they're crying because they don't want to go to the stranger, number one, and they're not with mommy and dad. Now they see mommy or daddy walking away. So that's separation anxiety. Their language starts with crying and cooing. And then, of course, they start playing, whether getting something, put it in their mouth, grabbing a rattle, listening to it, putting it in their mouth, all part of their play. And there's ways that we can, questionnaires and whatnot, we can actually look at anything. Social development, We know temperament. We know babies whose needs are met are going to be happy, right? And now toddler, ages 1 to 3. I think this is a fun age. It's a difficult age to take care of, but I think it is fun. This is the terrible twos. This is ages 1 to 3, and they are looking and getting into everything. I think this Jerry Seinfeld quote, having a 2-year-old is like having a blender without a lid. It means you turn it on and pff, they're everywhere. I mean, you turn your face and they're gone. They're into something. And that's what just 2-year-olds do. They're into temper tantrums. They want it now, throwing themselves on the floor. They're also into no, 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 no. Even if they should say yes, it's no. And of course, it's me, mine, toys, mine, and then learning to share. Horrible thing to do for a toddler. Again, their weight slows down. It's not like a newborn that goes quick, but you know, we're talking about birth weight should be doubled, we see quadrupled by 2.5 years. Well, it was already tripled at a year. So it's really slowed down. Again, they get pudgy, they get taller. They get pudgier, they get taller. And of course, the head is going to be less than their chest. Their body systems become more mature, heart rate comes down, respiratory rate down, actually blood pressures go up to where they should be, and they start to be able to control their body systems. Like this is potty training time. They have a lot of upper respiratory infections. Remember, everything in their mouth. Toddlers go to daycare or wherever, and what do? They explore the world in their mouths. They swap spit, as I call it, right? And it's all about everything in their mouth. So it's ear infections. It's all interconnected, right? Tonsils. This is all, you know, nose is running and mucus and ears are getting plugged, all a part of it. Now, there's difference between gross and fine motor development. We know the gross motor, they get better coordination. They're able to walk better, run better. This is about 2 to 3 years. Then they have manual dexterity. They can, you know, do things with their hands. Maybe a spoon is a little bit better than earlier. And then they can throw a ball about 18 months. Their visual acuity gets better and their depth perception gets a lot better. The one thing about toddlers is you have this infant who eats really, really well, and all of a sudden they're toddlers, their taste changes. So that horrible stuff that you didn't know how they could eat as infants, they're not going to eat it now. Have you ever tasted some of those meats in the jar? I think they're pretty horrible. But, you know, as an infant, many of them love it because their taste isn't as good as it should. They become really picky in their eating. And, you know, I've said it before, toddlers, I think one of the couple things that they like to eat the most is chicken nuggets, macaroni and cheese, and apple juice. I mean, any toddler is going to eat that. I mean, it's just part of, you know, I know, well, at least they'll eat that stuff. Now, is it good? Is it nutritionally sound? Well, we know it's not, but they go through physiologic anorexia at this stage. I know my husband, we kept him home for a while to watch my grandson. And I'd come home from work and he goes, he barely ate today. And I'm like, well, what did he eat? And I'm like, well, actually, that's pretty good. But he was concerned because he felt he wasn't eating enough. And most parents are. They need less. But look, they're not gaining that much weight. Okay. Their senses are better. They're starting to explore. Their taste buds are changing. They like things in their hands, smashing mashed potatoes and smushing them, and, you know, clay and sand and dirt. That sense, they like that feeling. It's just part of exploring the environment. So Erickson, toddlers, there's 2 components regarding it. When you talk about toddlers, we talk about there's that no, 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 no. That's what they do. They do start getting a conscience They know when they shouldn't do something. They know they're going to be punished on timeout for certain things. That's what toddlers says. But toddlers, the one thing you can do to keep a happy toddler is to keep them on a ritual, ritualization. That means they get breakfast at a time. They dress the same time. They have the same sort of foods, even if they're in a hospital vacation. Bedtime, nap times, try to keep them the same, and the kid will be a happier child, okay? As we look at Piaget, remember, this child here is learning how to manipulate their environment, their thinking. Remember, it starts out with, I need to see it, needs to be concrete. Then it starts to become more increasing logical, and they start putting ideas together and making it work. So Erickson, again, one of the thing about Erickson is when your child's 1 to 3 years old, it's easier to do it for the child, whether it's dressing them, feeding them, anything, but we shouldn't do it. We should give them that opportunity to do it because that gives them autonomy. It's a great feeling. Those things that you do not allow the child to do, they feel shame and doubt about. You know, it is easy for me to do everything. And I know my husband, he's a different culture, he's Jamaican, different feelings. And he helped me and my daughter raise him initially because he lived with me for the first 3 years. He would let him do whatever he wanted to do, but he would watch. He had the patience of a saint. I don't have that patience. I'm going to feed you to get it done. I'm going to do this to get it done. And it's actually, I shouldn't have done that. And thank goodness he was with, Pop most of the time, during the day when we were all working. So autonomy, they do what they want. They feel great about it. Shame and doubt is when you don't let them do new challenges. I mean, I've actually watched him jump from the top of a couch over to a hassock, half miss it, fall off and bop his head and get a knock. He never did it again because he tried once. Okay. Piaget. This is again exploring, starting to think. So he found the thumb, put it in his mouth, started sucking it. Now he does it whenever he needs to be soothed by himself. That's your primary. Secondary is now we can make noises, do things that you get a response to, okay? So I shook my rattle, or I looked at mommy and I was cooing at her and they liked it. So they're doing these things to get a response. And then as they get a little older is mommy went into the kitchen maybe to get him something else to eat or helping somebody else, but mommy wasn't there. The kid wanted mommy. Took the sippy cup, threw it on the floor because they know mommy's gonna come and be back next to them where they want them. So that's cognitive thinking, how to control a situation. I've really gone over what you need to know about Piaget. Remember, concrete is more now, we have the initial, when we look at it, the pre-operational, where these children, learn how to do things by themselves. Then, and we need it to be concrete. They need to see it, okay? See another kid do it, parent do it, somebody. Concrete now is when they take things and they start to become more logical. They start to figure things out, putting A and B together. These are your older kids, okay? As they become, toddlers, they start to understand that they have a genitalia. They have a penis, they have a vagina, and they're going to be putting their hands in their diapers and playing. And this is all normal. It's exploration of their body. And the one thing that parents need to do is, be accepting. But many times I'd say, go to your room if you want to play with yourself. Or get your hands out of your diaper. I don't need to watch you. Go to your room. It's okay. Or go somewhere, be private. And he got to understand these things. They understand a male is a penis and a girl has a vagina. They're starting to understand these at late toddler stage. Nana, you're different than me. You don't have a penis, he would tell me. Like, okay, no, I don't. Social development, remember, children are starting to understand that mothers and other women are different. Mother is a mother, Nana is a Nana, but there's other people that are not the same, and they're not going to act the same towards you. They're also going to start being individuals and doing things the way they want to do them. And we know transitional objects, these are things that eliminate stress. Ages 1 to 3, that usually their pacifiers are gone, but maybe they still have a blanket. Maybe they still have a stuffed animal, or they have something that they have to help them keep them stress-free. They're starting to understand more, and they're starting to have more words. I mean, an infant by 12 months will say mama, dada, maybe more, maybe milk, maybe mine. As they get older, they're going to start to put words together. They're also going to want to be more independent. Me do, as in taking their clothes off, feeding themselves, and they may not do it perfect. I mean, they'll take a spoon and have it upside down and try to feed themselves. It's okay. At least they're trying. It's giving them a sense of initiative, isn't it? They're doing things for themselves. And sure.
I'm so sorry. Is it helpful or a good thing to suggest it if they're not doing it on their own? So if they're not wanting, they didn't initiate feeding themselves or brushing their own teeth, is it okay to be like, hey, do you want to try to do this? Do you want, or should
Here's a
they?
toothbrush. Let me see what you can do. Hey, here's a spoon. Mommy's doing it. Why don't you try to do it with me? Okay. And you'll see these kids, you don't even really have to ask them to put things in front of them. They're new objects or objects. I mean, if they want you to feed them, get them a spoon that's special with pretty colors. Then they're going to want to use it, right? Now we made a game out of it. Those things do work, and they will try to get that sense of independence. And dressing themselves, here, have them do it themselves. Here, pull off your shorts for me. I mean, it's easier for the pants than it is shirts initially, okay? Or you want to help me with your diaper? Here, lift the tabs. Always give them something for that sense of independence. And you'll be surprised, little infants really do care about others. I mean, I have rheumatoid arthritis, and I remember one time I was about 2. He was about 2 years old. And I had ice on my knee. It really hurt. And all of a sudden, this kid came up to me, hugged my leg, and kissed my knee. And he goes, better. And how did he know that? And it's because they start to see me that I hurt. And he didn't want that. So they do very honestly, genuinely do, have concern. Can I tell you more about play, how important play is? We know that it's important to play by themselves. It's important to play with others, making sure they have toys that are appropriate. And there's all sorts of plays that they can do. Toilet training is when they're ready. When you'll start seeing, I got to go pee pee, or they start running, or you'll say, let's put on just pretty underwear. Do you want to, when you need to go pee pee, let me know. Or how many parents have that little toilet in the middle of the living room so that when they're running around, they could just sit and go, right? I mean, it's okay. It's just how we teach them how to do that sort of stuff. That little picture of that boy backwards actually helped me with my grandson. Because if you have them forward, they're going to pee on the floor. You have him backwards, this kid, he used to like to use his penis and make circles with his urine as it came out. But what did it do? It re-emphasized peeing in the potty, not into a diaper. So it worked. Now, again, I've always said, no, me do, mine is part of it too. But regression. Sometimes stressful things happen and kids regress. And what do? Well, they go backwards in development, where maybe they didn't suck their thumb, now they suck their thumb. Maybe they didn't need their blanket like they did when they're younger, now they're looking for it. They regress when they're stressed. And when you see them regressing, what are they regressing about? Again, we looked at this earlier. It's again another test for you to go through with developmental stages. So I said age 1, they have one word. By age 2, they're really trying to communicate and let you know what they want and what they need. And they're going to try to feed themselves. They actually like to play by themselves, and you should encourage that. Dressing and undressing. Can't tell you how many inside out backward shirts and shorts, but every time, yay, good job. I wouldn't tell them they did it wrong. I would show them and I would change it, but I'm like, wow, you did a great job. Next time, let's look for that tag, and it just became that, reemphasize it. But it was the good that emphasized, not that it was wrong. Car seats, that little metal box up there to the top. I actually remember sitting in one of those when I was a kid. I was like, oh man, I remember that thing. And I remember my little brother in one of those too. So you see how they've changed through the years. The thing with car seats, number one, they shouldn't be old. You shouldn't use that one from your daughter, who's 8 years old. No, they should be, maybe your best friend had a car seat that's less than a year old, that your best friend, it wasn't in a car accident, it's good. And of course, brand new ones are always the best. But getting a proper car seat's important. And we know that infants up to age 2 should be back seat rear facing. At age 2, they can turn around. Now, I was in a quandary. My 2-year-old grandson only weighed 24 pounds at 2 years old. He was a peanut. Does he get that car seat turned around? And the answer is yes. You don't have to be 30 pounds. They base it upon muscles and the ability to control muscles. And 2-year-olds can control their muscles in case of a hit, because I had to do research. And now let's look at preschooler, ages 3 to 5. So age 3 to 5, what we're doing, well, this is when we're trying to get them ready to go to school, which means somebody else is going to be watching over them. They have to learn to follow other people's instructions. They have to have longer attention spans. As they're into preschool sitting, they need to get along with other kids. And it is that step in getting them ready when they go completely to school. They say you should read to your kid daily. My grandson is very lucky. My daughter loves books. He gets at least 4 books every night. And he actually could repeat the books, but 4 books. And he's getting to the point now where he can read a lot of the words as she's going along. He's become a smart kid because of that, because of, my daughter, she's good. If a kid can't go to preschool or is not in daycare, things that should be done is putting them in activities with other children so that they can get along with other kids. It could be things like ballet, gymnastics, into sports. Those things will help them when they get to school. And then, of course, always give them that positive attitude towards learning. Again, preschoolers don't grow that much. They're still about 5 pounds a year, and they're growing, but slower. And these bodies are more mature. They can tolerate stress and change a lot, and they don't need the rituals like the toddlers and infants do. They do a lot better. Gross motor, they can run, walk, climb, and jump. 1 foot, 2 foot, they can do it well. Fine motor, there's really good eye to hand. They're able to dress themselves a lot better. Drawing a lot within the lines, okay? They can button their shirt, right? Fine motor. Remember, as you look at questions regarding growth and development, no, is it fine fingers or is it G, get up and go, 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 gross? So Erickson is that at this time that when they don't do what they're supposed to do, they feel guilty. They get anxious. they have this, what we call a conscience. When they do something wrong, they expect to be punished. They learn that they want to do right things for people. They want to get that praise. A little bit different than Kohlberg, but in a way a little bit similar. Ready for school, ready for learning. And of course, we're going to make sure that these kids are ready to pay attention for those long days in kindergarten. Piaget, ages 2 to 7, again, they're starting to be aware of logic and building upon that logic. I mean, pre-operational is initially, we talk about concrete. As they get up even further into it, we're going to be talking about children who are in the concrete operational stages. At this time, they're going to be more logical. They're starting to say, well, if this and this does that, well, this should do it too. They're starting to learn and think more. They're starting to say, well, these things are all colored red, and these are trucks and this and that, but they all have wheels. They all roll. Earlier, that they don't understand those sort of things. They're starting to talk up a storm, learning more words. They're understanding consequences, and they don't understand time. When my grandson comes to visit me now, he says to me, so how long can I be here? And I go, 2 morning times. He knows the morning will come 2 times. That's how long he can stay here. He doesn't understand 2 days. He doesn't understand at 2 p.m. we'll do this, after lunch, after your nap, when you wake up. He understands events attached with time. That's the only way. He doesn't understand the clock yet. And they are so into magical thinking. These children sit there and they're playing by themselves and talking and things flying in the air and making their own little stories. It's magical. And actually, I love listening to them. Again, Kohlberg is all about morality. There's wrong and there's right. And wrong is a consequence, and right is a consequence. And you get a nice consequence if you're right. You get those praises. If you're wrong, you know that you're going to get some sort of punishment with it. You know, as they get older with Kohlberg, sometimes they have to do wrong, and they know it's a consequence, but they need to do it, so they're going to do it anyway. They understand wrong, what's going to happen, okay? Punish and obedience. Girls like daddies and boys like mommies. This is what they say. They like the different ones of the opposite sex. They become more modest, where they didn't care before and ran around the house naked. Now they don't want you to go into the bathroom with them as they're doing their own thing, because they now have, they're modest. Again, they're exploring themselves. If you have a child, you know, I've seen it several times where I'll walk into a room to take care of a child when I was in the ER, and maybe they're rubbing their little toy against themselves in a form of masturbation, right? What do I do? Well, it's not a bad thing. They're exploring themselves. I say, you know, Mom, I'll be right back, and turn around, leave for a couple of minutes and come back. I'm not going to bring in attention. Why are you doing that? Stop doing that. Get that away. It is all extremely normal. They're also going to start asking about reproduction and how did the baby get in your tummy? And the thing with that is, ask them what they know and then answer the questions. You don't have to give them that in depth. They usually don't know it. Just say, Daddy said he wanted it there, and that's the way they got there. They hugged each other and made a baby. Whatever, you know, you think the child can understand. As I said, that ritualism and that negativism is starting to decrease. Dress themselves. They love to please. They like to show you they can do things. And again, they are becoming the culture and the values of the family. They're understanding what their religion is, what it means to them, and they're becoming a part of the family that way. but they are going to start to challenge punishment and conduct. And why can he stay awake? I want to stay awake. I want to watch a movie. I didn't do anything wrong. That challenge is going to start. Types of play: associative, playing together, no rules, right? And, when you're imitating, you're doing what somebody else is doing. And imaginary. These children, preschoolers, do have imaginary playmates. Absolutely, perfectly normal. It's when they get to be 8 or 9 years old that they shouldn't. Yes, Elvira?
I was wondering, is it okay, is it a good thing that they're challenging the family code of conduct? Is that something that we're supposed to say, give a consequence for, or something that not necessarily encourage, but let?
They have questions. They want to know the why. And once you maintain one way and you don't give in, they want to do more, get more. Like, I wanted more ice cream. He got it. I didn't. You know, you have to show them, you have to do something to get it. You know, you have to, explain it to them. And it's okay. We all question authority. It's part of life, isn't it? Making sure that we're getting what we're supposed to have. So absolutely, they can do that.
Thank you.
You're welcome. Dramatic play. This is what we would use at a hospital, maybe, where there's maybe sexual or physical abuse. Playing with toys, dolls, we could find out what happened. And of course, playing together. They're afraid of the dark. Go turn the lights on, nobody's there. If you find a ghost, let me know. I've been telling Christian, he's going to be 6, in January. He just doesn't like the dark and does not like to be left alone. If we are outside and he's left inside, he will be crying. He'll become running out. Well, where did you go? I mean, it's just part of, they want somebody there. And they are afraid of nurses or doctors, especially if we've given them pain in some way. What do nurses and doctors do? We give them shots, injections, we squeeze a tight blood pressure cuff. These things inflict pain. They are going to be afraid of us. And it's just part of them. And it's trying to explain it. Sometimes it works, sometimes it doesn't. As I said, with sexual education, find out what they know first before, you start answering it. And be aware that masturbation is extremely common at ages 4 and above. And younger than that, they're exploring themselves. And of course, the fears. So let's do some Kahoots. A lot of different things, a lot of growth, development. There's a lot of things to remember. You'll see the things that you'll see keep repeated in the Kahoots and on the slides. Those are the things you need to remember. Okay, it's hard to remember all of it, and I know it is. Who wants to win Kahoots today? Ashton, you gonna win? Shaylin? How about Mia? Yeah. David, you're gonna win?
I felt more confident last time.
Oh, you did? Well, let's see what we do. I think you're gonna be fine. Now remember, I do these Kahoots and I make sure the concepts you need on your quizzes, exams, HESIs, and NCLEX are there. These are things, if you ever become pediatrics, you're going to remember, oh, Professor Bogart said that. And that's why I keep repeating these. Hopefully you came to class already with that interactive PowerPoint. You've looked at the stuff. Come here, listen to the way I teach this PowerPoint. And then the third thing, I'm going right to Kahoots. These Kahoots have every concept you need, and they already actually have concepts missed on the previous HESI last semester. I've already incorporated it into this one. So I tried to give you all the information you need to be successful, okay? I work hard at it. Just like you work hard to do your best, so do I. You like the Halloween Kahoots? I think it's pretty cool. You'll have one for Thanksgiving, one for Christmas too. Let's get going. We get out of here probably about 10 till, I would imagine. Week 2, infant, toddler, preschool. It's going to be week 10 soon. You'll see. A multi-select. Types of play considered to be sense pleasure play. Sense. Remember? Sensorimotor sense. Anything playing with stuff in the hands that's texture, sand, finger painting, mud, water, anything that you play with your hands with. Checkers is a game. Coloring a picture is not. The play, sense, pleasure are those. What type of play is considered cooperative play? Now you're going to see some of last week's questions repeated because these are concepts you need to know. And I need to spell race car better, don't I? I think my fingers went like this. So cooperative play, what is it? It's children getting together, and it is playing something with rules and an outcome. Somebody wins. Checkers is a great example of that. You know, it's just playing sorry Paw Patrol, you know, with a little pop-up button. My little 6-year-old grandson beat me 2 games, and he played correctly, and I didn't cheat. According to Kohlberg, pre-conventional level of moral development, a preschooler who has moral development, moral reasoning, what? What's Kohlberg all about? So remember, Kohlberg's all about right and wrong and a consequence for each. Okay, good. If you do something good, somebody's going to say, wow, what a great kid. That is a consequence. Did something bad, you might be on timeout. Your life might be over for a day. Which nursing action is appropriate to teach a preschool aged child about a scheduled procedure? You need to bring a kid needs to go, it's pre-op for surgery, or it needs to go for a radiological examination with x-rays and IVs. And how are we going to do that? These kids are afraid of us. So first thing we're going to do is break the ice open, get on their level, their developmental level, and then we can use a doll. That's a visual, right? I can see it. It's something that's right in front of me, and I'm like, okay, it's concrete. These children will understand it. Multi-select. What are some findings from a pediatric physical assessment? Now, we know we do a history and physical. I'm just asking about a physical assessment. Remember, physical is what you can look, you can see, you can hear, you can touch. I want to look at the growth. I'm going to look at their body systems, listening to their lungs, their belly, their eyes, all that stuff, and take vital signs like a temperature. Medical history is that, a history. It is not physical. Good job. Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? So you walk in a room, you've got a 2-year-old sitting there. First thing you do. I mean, there's many things we need to, but first. Number one, you're not going to do anything to that kid first. Minimal contact first. That's number one. Then you're going to tell them, that's a Batman shirt. I really like that. Or, wow, those sneakers light up. Can you run fast? Or maybe they have a toy with them, something. I'm going to break that ice. So don't touch them. Minimal first. Talk to them. Developmentally appropriate conversation. Then I'm going to let them use play, and I'm going to let them touch the equipment. That's the way it should be done. And your kid will do it. If you try to go in there and touch them and let them see things right away, they're not going to listen. You've built up no trust with that child. What would you suspect if you note that an infant's chin is quivering, the fists are clenched, and they're inconsolable? They're crying and you can't stop it. It's like their little chin is quivering. What is that? That is true and real pain. And what if they're shaking their head and they're banging their head, their ear? Well, they're showing you the location of it, probably an ear infection, right? Infants can show you exactly where they hurt. You've just got to look at what they're showing you, okay? A multi-select. Erickson describes infants as trust versus mistrust. What does trust mean? So trust means that the baby is happy because they know when they cry or coo or yell, somebody's coming into them. They can predict what's coming, their needs are met, and this is your happier child, okay? This child does not have to cry longer because these needs are being met. A 3-year-old child is having an outpatient procedure. How would you help the child be less fearful? You need to go to the hospital and they need to do an x-ray of you. I'm sorry, if I was a 3-year-old, I'd be like, what? And I'd be afraid. Hospitals are a scary place. They always stick things in the nose and the throat and they prod you and blood. I mean, this is the way a child thinks. So you're going to have an outpatient procedure. Maybe they need to go have their tonsils out or tubes put in, right? You give them a doll. Let them work with what things are, how things will feel. Let them ask questions. And this child knows what's coming next. They're not going to be afraid or less fearful. Multi-select. You need to do an assessment on an infant, and you walk into the room and the infant is asleep in the mother's arms. Well, what do you do now? If I have an infant asleep in the mother's arms, I'm going to listen to their heart sounds and their respiratory, their lungs. I want to hear it because they're not making all this noise and they're not moving. And I'm going to get it really, really accurate. The parent's going to continue to hold that child because comfort position of parents holding children is the best position to do many things with children. When do you switch formula to whole milk? We know we go from just milk, as in mother's milk or iron fortified formula for the first 6 months. And then we'll introduce foods one at a time, 4 to 7 days in between each introduction. Milk, whole milk, not skim milk, 2%, whole milk, 12 months. They need the fat. A multi-select. When teaching about car seats for a newborn infant, so you can use a gently used car seat from a friend, less than a year old, fine. Of course, it's rear facing, back seat, and of course, new car seats. We're not going to be using an old one that you used for an older brother or sister. No, that is, they do get outdated. So it's expired, literally. A multi-select. How and when do you introduce solid foods to infants? So we know the first 6 months of life, an infant's GI system is very immature. Anything they eat, it wouldn't be absorbed. So we're going to introduce them at 6 months, one food at a time, and we're going to wait 4 to 7 days in between before adding another food. And sometimes the reaction, the intolerance could be maybe a little spit up or vomiting or a rash. A rash is probably the most that you'll see. Before assessing a 4-year-old child, what techniques would you use to approach this child? So again, break the ice, do something, okay? Telling what the kids, what you're gonna do to them? No, not yet. Your first minimal contact, tell them, hey, that shirt's cool, then start letting them see the equipment and then explain it. If you come out with what they're gonna do, they don't know, they're not gonna listen, and they're gonna be afraid. What technique can be used to examine a toddler? I think you've seen by the amount of questions that I'm talking about on how a nurse can approach a child is so important. Play, play, and play. Children, of course, you go in with least, touch at first, then you're going to break the ice, and then we're going to start to play. Is this my ear? Is this my nose? I mean, start doing things and having them giggling and, thinking it's a lot of fun. Because remember, play, they love to play. When assessing a healthy child's lymph nodes, what would you expect? Kids just getting a well checkup. And doctor is going to examine the neck and lymph nodes. What should he see? Should not feel them at all. If a kid is healthy, not sick, there should be nothing. Lymph nodes get big when a child is sick. Okay? Which Erickson stage of developmental levels would be used for a toddler? Remember, with toddlers, we want them to be autonomous, to do for themselves. And when we hold them back, they feel that shame and doubt. So we need to let them to try. What pain scale would you use on a 3-year-old child? When you have a 3-year-old child, it's a preschooler. Ages 3 to 5 are your what? That is faces. When they are younger than that, nonverbal up to the age of 3, it is flack, okay? It's opposite the way that I asked the question last week. So think about, the pain scales. You'll see questions about pain scales. A multi-select. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does this mean? So what it means is that you allow that child, that toddler, to try new things, even if maybe they're going to fall and bop their head like my grandson did. So he only did it once. That shame is when you don't let them, that you hold them back from trying to attempt to do things, and they feel shame, and then they also feel doubt, but gee, I can't do that.
I had a quick question.
So hold on a second. A
Sorry.
2-year-old boy is playing with mud and dirt. What type of play is this? I'll answer as soon as this is done. I'm sorry. Dirt, mud, sand, finger painting, all of that good feel. And it's called that sense pleasure. Yes, may answer your question.
So in the last question, it was talking about a toddler, and then in the answer it said infant.
I meant to say toddler. It's the same
Okay.
thing. Sorry. I
No,
will
that's
change
okay. I
that
just wanted to double
question.
check.
No,
I
no, no,
overthink, so
no.
that's something that would trip me up.
I saw that. So yeah, I'll be changing that. Thank you for letting me see it. Yes, somebody else?
Yes, please. So regarding that last question, why was the toddler playing by themselves not part of that? Doesn't that give them autonomy as well to be like,
No, it's not that they're playing by themselves, that you let them try new things,
hmm,
being
gotcha.
autonomous. I mean, any child plays by themselves, but Erickson talks about the autonomy is they're able to do things by themselves that that are challenging, that you give them new opportunities that they've never done, like jumping from the couch over to the hassock. You let them try to do it. It makes them feel autonomous, makes them feel like they tried to do something they didn't do before. So it's like a new adventure. Okay. Remember, I don't mind questions at all. I hope I answer them okay for you. A parent of an 18-month-old boy said he says no to everything and has really rapid mood swings. An 18-month-old? No, 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 no. Rapid mood swings? What is that? Absolutely normal for this child. That's what toddlers do. No, no, me, mine. Okay. Very moody children. Those temper tantrums, throwing themselves on the ground. What do you do with a temper tantrum on a toddler? Well, a lot of times I think of my grandson or my children in the grocery store. They didn't get something they wanted and poof on the floor, and they're screaming. What I do, just keep going as long as they are not going to hurt themselves. Ignore the behavior. They want a response. They want you to, do something because, in front of all these people. Well, I don't care. You can think all you want. My kid's having a moment, let them have it. And I keep walking. I know it's hard to do that. I know it's really hard. What is descriptive of a preschooler's understanding of time? At 4 o'clock, we are going to go and get some pizza. Does a preschooler understand that? Or does a preschooler understand after school, I'm going to pick you up and we're going to go get pizza? It's that times associated with events, has nothing to do with that 2 o'clock. They do understand time. They do, but only when it's attached to an event. When you wake up tomorrow, we are going to. When you go to bed tonight, those things. A 4-month-old infant's crying and shaking their head. What feature of pain is this infant showing? And their lip is quivering and they're unconsolable and they're shaking their head and they're batting themselves. What is that? That's telling you the location. Okay, it's telling you where it's at. I mean, the intensity, you would do a pain scale you do a FLAC and you would see it's a high level. So it's big, big pain. The faces, their legs, their consolability, those things, their activity is going to show you it's a high level. but that shaking the head and maybe even hitting it, it's somewhere in the head. That's what's bothering them. Sometimes they put their fingers down their mouth. A 1-month-old infant's back of their head is flat. What would you tell the mother? I know my daughter went to the pediatrician and says, my kid's head is flat. What can I do? Does he need one of those helmet things? And the answer is exactly what the pediatrician told her, which is exactly what I had told her. Give them tummy time, get them off their back, and their heads are so soft, it will round out. And today, this kid does not have a flat back of his head. It did come back the way it should. Infants crawl before they walk. This pattern of growth of development is called what? They crawl before they walk. They lift their head before they roll over. They roll over before they crawl. They crawl before they creep. What is that? And we know this all happens in a sequence, right? It's sequential trends. Very good. You were listening. How do you communicate with parents that do not speak a language that you know? You know, I've had languages, I think Mandarin Chinese was the most difficult one that came to me. And of course, Portuguese was a rough one for me also. But again, we're going to use that little blue phone. It works really well. And if you use somebody in the family, they're going to put in their own opinion of what the mother's trying to say. So we want exactly what they're saying. And you can only do that through that blue phone. What age would most children understand under, on top of, beside, and back, around, over, next to, all of those good stuff? Go get your shoes. They're underneath the couch. Your juice is on top of the table. And that, remember when and this is the hard part in pediatrics, if you have children, forget you have children, forget they've done what they've done at their ages, because my grandson at 2.5, 3 years old could do this. The answer by the book is 4. So I'm going to warn you, forget you have children, remember what the book says, okay? And I know that's hard. And actually, those people, you know, students who have no children, this class is easier because there's no preconceived ideas. And I know how hard that is. In terms of language and cognitive development, a 4-year-old child would be expected to what? Follow simple commands. Go take your cup, put it in the sink. Take your dirty clothes, put it in the laundry. Take your shoes, put them by the front door. Simple, simple commands they understand. This is concrete. They get it. They understand it. What pain scale would you use to assess the pain of a toddler? Toddlers are ages what? 1 to 3. So when you're talking about pain scale, toddler, absolutely the FLAC. Very good. Faces does not start till preschool. Multi-select. What safety instructions would you teach the parents of a 6-month-old child? So a 6-month-old child should be in a car seat, rear facing. Of course, those electrical outlets, cover them, and be careful about laying them on couches or changing tables or anything. These kids are flipping over and they're turning. So as they developmentally get more and more things they can do, you have to be really careful about that. I'll multi-select. What are the cognitive characteristics of a child ages 2 to 7 in the pre-operational stage? Remember, you start with pre-operational, and then you're going to go to your concrete. You know, concrete operational, remember, they're becoming logical. So it's not logical initially. At first, remember, thinking is concrete. They don't know what other people think at this age, okay? They can play with stuff like the broomstick and a horsey and ride around the house on the broom. They could do that because they're imaginative. So when we talk pre-operational, think concrete. It's they can see it. You've shown it to them. There are wheels on a car. You push it, it rolls. That is concrete. As they get older and they get into the concrete operations, then it becomes more and more logical, putting more things together. Well, if this has wheels and that has wheels, well, this must work like that too. Becomes more they understand more logical. A nurse receives a phone call about her 6-week-old baby. He's crying a lot, and what can she do? Mom wants to know what she could do for her baby. He's crying a lot every day. It's just an infant, he's 6 weeks old. What are you going to do? This is an infant, very, very brittle age. They're young. They can, get sick critically very, very quickly. This child needs to come in and needs to be seen by a physician. You cannot give any information over the phone for that child. I'll multi-select. What should an infant be able to do at 9 months old? This question has both fine motor and it has gross motor. Sitting with support? No, they should be able to sit without support. No pillows around them by 8 months old. They should be able to voluntary grasp a rattle. They should be able to pull themselves up and maybe the side of the couch or a table. And of course, roll completely over by 6 months old. So those are those answers. The first expected fine motor developmental milestone for an infant begins with what? What do they do first? Fine motor, F, fingers. So the first is reflex palmar, second is voluntary. Okay, then it goes to pincer and putting objects in a container, block of 2. That's the way it goes with fine motor development. A toddler parent asks the nurse for suggestions on dealing with temper tantrums. Middle of the grocery store, lays it on the floor and is screaming. You didn't get him the toy in a box of cereal he wanted. Again, ignore the behavior as long as they're not going to have injury from it. Because when you start answering to that, they are going to continue to do that to get what they want. A 2-year-old has difficulty in activities, sensory sensitivity, and only speaks one-word responses. How can you assess what's going on with that child? In pediatrics and more than adults, I think there's all these questionnaires and checklists that we can use to help us diagnose children and so that they can get the proper treatment they need. This child, when you see sensory sensitivity and not speaking that much, probably this kid's going to be autistic. But how do we determine that? Let's do this checklist. Let's see what's going on so that we can get this child the interventions it needs.
Ma'am, question.
1 second. Patients are concerned her 8-month-old child is not developing like their older child. What is normal for 8 months? Eight months old. What is a kid supposed to be able to do? And they should be able to sit alone unsupported. Okay, question. What did you have?
The previous question before this one, I was thinking that if you use that questionnaire regarding like the autism, right? Wouldn't that you be suggesting that they actually have that rather than using the behavioral question to kind of cover your base?
Well,
Basically.
you could use both. What that question is all about, if you were trying to say, maybe you've done other ones already, this is just one of those checklists you could do. We don't even look and try to even put a diagnosis of autism on a child to after they're 2 years old. And we start seeing things. And that would be done initially through that checklist. So that probably other checklists would already have been done. You see what I'm saying? But that's a great question.
Thank you.
No, you're welcome. What fine motor skill is expected of the 4-year-old? Remember, fine, F, fingers. So fine motor skills, 4-year-old, buttoning a shirt. Tying a shoelace is not till 5 or 6. And then walking up and down stairs, that's gross motor, right? But actually that's about 18 months old. Using both feet, yeah. A multi-select. What gross motor skills should a 4-year-old be able to do? So gross motor, of course, walking upstairs both feet. I told you about 18 months they could do that. Hop on 1 foot, both foot, doesn't matter. They should be able to do that also. Jumping rope is older, and shoelaces is older, 5 and 6 years old. Doesn't mean some kids can't do it, but according to the book, that's what it said, okay? That's the hardest part about this course, is what the book says and what you've seen in your children and others. RN's doing a developmental screening on a 10-month-old. What should they expect fine motor skills? 10-month-old, what should you expect fine motor for a 10-month-old? So last week we had one about it, and it was a younger child, 7 months old, and that was a gross, crude pincer grasp, and then grabbing the rattle. But as they get older, they're going to get into be able to pick up one little piece at a time and eat it. So that is the pincer grasp with the rattle. Okay. So remember, always look at the age and put it together from there. Frequent developmental assessments are important for which reason? Why do we need to know if they've turned over, they can button their shirts and hop on a foot, and why? We need to know because if something's going on, we can institute early intervention, or we can do something to find out why is it happening? Is there something going on cognitively? Is there delays due to, something that we haven't picked up yet? So we really doing frequent developmental assessments can catch things early, and we can start early interventions, or we can catch some medical conditions before they become really serious. A multi-select. An infant searches for her toy that is not in sight. What is this? Well, an infant is searching for a toy that is self-exploration, and it's memory because it's object permanence. They know that even if it's hidden, we know it's still there. So it's those three. The natural physical developmental sequence that most children follow is what? This is all about those gross motor things that we do. So we know the first thing is lifting the head. Lifting the head, roll over, front to back to front, up on our knees. We creep, we crawl, we cruise, we walk. It doesn't mean they don't skip something, but that is the sequential trends that should be followed. A multi-select, which would alert the nurse to hold digoxin on an infant she's caring for. And this is one of the reasons why we need to know normal vital signs. What if instead of an infant, I say a 2-year-old? And there's some components of this, it doesn't matter if they're adults or children. Potassium level, digoxin level are the same numbers for kids that they are adults. Just because they're smaller makes no difference in what those numbers are. But that heart rate is a big problem. And bounding peripheral pulses has nothing to do with digoxin, okay? In general, an infant should triple their birth weight about what months of age? And we know that should be at 1 year, 12 months old. Born at 7 pounds, they should be 21 pounds. Why do we need to know that? Well, if they weighed 14 pounds, they're not getting enough nutrition. We need to look at development and cognitive delays, right? And what if they're 28 pounds? That means they're getting too much nutrition. Maybe we need to decrease the amount of calories that they're getting. It all depends. When an infant's toes spread, when the soles of the feet are stroked, this is called what? That splaying of those feet. Same name as adults, same reflex. And that's called Babinski. Rooting is when you take and you touch the side of the cheek and the baby's head looks for a nipple or a bottle, okay? Startle is when they hear a loud noise or a sudden jerk. All of a sudden their hands come up and it's either startle, okay? And then of course we know grasping, voluntary and involuntary. So when entering into an infant's room, the door slams shut and the infant jerks and starts to cry. What is this? What type of reflex is that? And that's either startle or moro, same thing. You can use both of those names the same way. Good. A 4-year-old is reluctant to take medications. What intervention should the nurse take? I think this is probably one of the hardest ages that a child really doesn't want to take medications. So you're going to use a straightforward approach. Now, I'll ask you a question. If you take medicine and put it in a bottle and they don't finish it, how much medicine do they get? Especially if it's things like digoxin. Now, if it's a little bit of food or a little bit of juice in a spoon, that's one thing. What does a straightforward approach mean? You need to take your ibuprofen. Would you like liquid or would you like a chewable pill? You want liquid? Do you want it in a cup, a spoon, or a syringe? Straightforward approach. You want it in a syringe? Here, let me help you. Straightforward. Which intervention helps a hospitalized toddler feel a sense of control? What did I tell you about toddlers and how they feel better? Again, following the normal routines, same sort of foods if possible, same time for bath time, naps, everything. It does help a child feel better and they're going to be less frustrated. They know it's coming next. An RN assessing a 2.5-year-old toddler, which findings should you report to a provider? Like what's not right? Again, that's when the head is bigger than the chest. And again, it needs to be investigated. Why? Is it your hydrocephalus, tumors? What's going on? A multi-select. What are the risk factors for SIDS? We know gender, males more than females. If they just recently been sick, that is another risk factor. Exposure to secondhand smoke, being overheated, sleeping in a bed with parents, soft mattresses, too many things in the cribs, all of those things are risk factors for SIDS. Breastfeeding actually helps decrease the amount of SIDS death. What does the rooting reflex enable the infant to do? When they're rooting, you touch their cheek, they're looking for something to eat, so you can breast or bottle feed them. A multi-select. A child's been admitted with profuse diarrhea for 2 days. What would you expect? Now, what I have seen in the HESI, they are putting more and more acid-based questions. I know you have it in MedSurg too. So I'm also, every single Kahoots, you're going to see something. I want you to understand acid-base balance. If you're having diarrhea, it's more alkaline because of those nutritional digestive enzymes. So you're losing alkaline. So you're left with acid. So it's metabolic acidosis. And any diarrhea, those things, it loses potassium. So it's hypokalemia, okay? If I'm vomiting, it's going to be metabolic alkalosis. You're getting rid of acid. These are things you're going to see. So something I give you every week to help you. Just not for me, but for MedSurg too. An infant's unable to take the breast or bottle feed. What's important to remember? So you have a kid with some condition where they can't eat. What do we need to remember to do for this child? It helps promote growth and development. And that's giving them a pacifier, non-nutritive sucking. Remember, how do infants explore the world? How do they self-soothe? with their mouth. It is something that's very important so that when they're able to eat, you have promoted that with that non-nutritive sucking. And we don't put anything in a mouth on some diagnoses because it can cause choking and aspiration pneumonia. So nothing in the mouth. And last question, what does an infant start to do at 3 months? And there's actually 2 answers it could be, but it's not a multi-select. So they can lift their head up, yes, head control. But the one thing I was trying to make the point of is rolling over. So this is a child you have to be careful with and protect with safety. So number 3, how'd we do? Lyric, good job. Number 2, Amber. Number 1, Mia. Number 4, Heather and Ashton. Good job, guys. Long Kahoots, but so many great questions there for you. Remember, the concepts are so important. Make sure you go back and look at the Kahoots every week. It's that reinforcement of those concepts you need to know. Sign your attendance attestations. Please don't forget. You're going to do quiz 1, this discussion question 2, and your attendance attestation. So there should be 3 points of touching in Canvas that you should be good. Any questions? Thank you, guys. Have a great week. Anything you need, let me know, and I'll get back with you, okay? Good night, guys.